18 healthcare workers were arrested at the Colonial Heights Rehab Nursing and Facility. They're located in Virginia, and it's a skilled nursing home. And what happened was state showed up in response to a 74-year-old patient that passed away. Now they're saying that the 74-year-old, that prior to her passing away, she was neglected. She had been left in her bed, like covered, soiled, covered in feces, in urine, and they hadn't touched her in days. And because of that, she developed wounds, and then her wounds got infected, so she became septic. Therefore, she had to go to the hospital, and then she ended up passing away. They arrested the administrator, the DON, and the nurse that was caring for the patient, and I'm thinking that the rest of them were CNAs. I'm not sure. But when they showed up to work, the police was there, and they arrested them. Like, that is so humiliating and embarrassing. They said that the lady, she was so bad off that her vaginal area, the wounds were so bad it looked like she had been SA'd, like tormented. Y'all, they said it was bad. And they're being charged with 7 counts of felony abuse and neglect to a vulnerable adult, 2 misdemeanor counts of abuse and neglect to a vulnerable adult, 2 counts of obstruction, and 27 counts of falsifying documentation. They were definitely short-staffed, and that's what they ended up arresting the administrator for, because of the staffing issues. They would have 2 nurses, and they would have 60 to 70 patients when they should have 3 nurses, and then 2 CNAs with 60 to 70 patients when they should have 4. They refused to bring in agency unless it was somebody from like one of their sister facilities. Then they would bring someone in to help. But that's the only way they were going to bring someone in. The rest of it is like, as long as we have a body. And the falsifying documentation, that came from the nurse that had the patient. She was falsifying, saying that she did the wound care, saying that, that the wound wasn't infected. It looked good, when in all actuality, the lady was septic the whole time. And she actually ended up dying because of it. So obviously that was a lie. But for all my nurses and my CNAs out there, we all can attest to how understaffed we are and how many patients they give us. And they be like, oh, well, the ratio is, in Florida, it's 1 to 40. So we just going to stick y'all with 40. No. Just because we can have that many doesn't mean that we should have that many. Because at the end of the day, what about the patients? Like, if you give one nurse 40 patients, she doesn't have time to stop and actually give the type of care that needs to be given to all 40 of her patients, especially when you have to look at the acuity of them all. But one thing I learned about these nursing homes is that they don't care. They don't care. Administration doesn't care. As long as the money is looking right, and as long as, we have enough bodies to barely cover everything, then it is what it is. We don't care, because we don't have to work it. We don't care. And if we do have to work it, we going to have some help, are we only going to do half the shift? Like, I see it all the time. So this is a sad situation, because it's like, yes, y'all neglected that patient. Y'all sure did. And I don't know why y'all would leave a patient there in their urine and in their feces for days and days at a time. That right there, I believe you should be arrested for. But then we have to come back and look at the staffing issues. Like, we need some help in the healthcare industry, because it's not going to work. Like, that's why so many nurses are leaving the field, because y'all are just leaving us out there looking crazy with all these patients, and then y'all expect us to do everything. You expect us to pass meds, do the doctor's orders, do the wound care, take care of people when they fall. We got a whole bunch of paperwork to do off of that. Like, there's so much to do when it comes to nursing, and we have no help. And then the family members, they expect so much out of us. And a lot of times we can't give it, because we don't have it to give. They have got to do something about these nursing to patient ratios. I mean, because it's ridiculous. There's no way any type of like we can't do it. Like, we need help somewhere in the healthcare field. Somebody has to stand up and do something. And I feel like as nurses, if we don't get together and do something, ain't nothing gonna ever be done. We got to start speaking out. We got to stop accepting assignments. We got to stop taking them keys. Just, I'm not taking the keys. If I got to have 40 patients, I'm not taking these keys. You do it. I'm not doing it. One nurse should not be able to run a whole unit by themselves. There needs to be 2 nurses. Like, I don't understand what the world is coming to. But y'all let me know what y'all think down below, because this is a very unfortunate situation.